My name is Dr. Michael McKinley from Progressive Physical Therapy and Rehabilitation. I want to take a moment to talk about chronic pain and how different treatments can actually help people with chronic pain even when things have failed in the past. So I think the best thing to understand is what is chronic pain. So there are three phases of pain. There's acute, subacute, and chronic. So acute pain is defined as pain that occurs in the first, say, 7 to 10 days. These are people that sprain their ankles, hurt their back, pulling weeds. You have a pain for a short period of time, typically responds to over-the-counter anti-inflammatories, rest, ice goes away on its own. Sometimes these pains do not go away on their own. And if you do have an acute pain that lasts 2, 3, 4 days, and the pain is not reducing at all, this is a good time to call your doctor or your physical therapist, because the sooner we get you in, the easier it is to fix these types of problems. Subacute is a transition period. When you get out of that acute phase, so you're talking about 2 weeks, sometimes up into maybe 2 months. This is where the body is still healing. A lot of times this is bigger injuries. This is hamstring strains that aren't going away, back pain that doesn't seem to go away from an accident. You're normally on medications. A lot of times people have seen their doctors, but for the most part, it's just amount of rest, maybe some stretches. This is where most physical therapists will excel, is in this subacute phase, where you go in, you have an event. I pulled weeds this weekend, I bothered my back, I twisted my knee, and you're on rest. Do a little bit of exercises, a little bit of stretching, everything feels fine, you feel 100%. And then there's the more complicated chronic pain patient. Now this type of patient gets misdiagnosed commonly with the MDs and with the PTs, even the chiros, acupuncture. So what happens is when your body goes into its chronic phase, you've now gone into multiple months, 6 months or greater. What happens at this phase is that the tissue itself actually begins to change. So you don't have normal healthy muscle tissue. This muscle tissue has now been torn or sprained. Blood has come to the area, scar is formed, nerve endings are irritated. Then you start laying down more scar, and then you begin to compensate. These are the times where you don't feel like you're limping anymore, but maybe your spouse or maybe somebody says, why are you still limping? Or why are you still favoring your back? A classic comment of somebody who has chronic pain is when they tell me that months or years ago they hurt their back, and it doesn't bother them very much anymore because they don't do this anymore. They don't lift the laundry basket anymore. They don't garden anymore. Their knee bugs them, so they just don't go upstairs like they used to. So rather than going one step at a time like normal, maybe they go one step and then bring the other leg to the same step. These are type of activities that have just created compensation. So is your problem really gone? No, you've just compensated for it. These types of problems are a little bit more in depth. Physical therapists need to take time to evaluate what has really caused this chronic problem. For instance, and this happens quite often, somebody may come and see me because their knee has been bothering them for 6, 8, 9 months. And they have, say, problems going up and down stairs, which is pretty common. When they saw their orthopedic surgeon is a knee guy, so he purely looked at their knee. Maybe did an x-ray and MRI, nothing was found. Maybe small changes, arthritic changes, degenerative changes, small meniscal tears, which are common, but nothing that explains the amount of pain that you're in or the amount of limitations. You may have tried medications, whether it's pain meds, anti-inflammatories, even cortisone injections, all with little relief. When they come in to see us, and not all physical therapists do this, which is why I warn you that if you've already seen a physical therapist in the past, that doesn't mean physical therapy cannot help you. And the reason why I'm saying is people may complain about left knee pain, but when you come in here, we're going to evaluate you from your feet all the way up. So what we see most commonly is that it's actually the opposite hip. Maybe it's weak, maybe it's stiff. And when we start to really go over this with patients, we find out that maybe they had a hip problem even 5 or 10 years ago. That again, if you remember earlier, when you have chronic pain, you begin to compensate. So they'll just say, oh yeah, I didn't do that anymore. And eventually started putting more stress onto the other side. So the reason why treatment didn't work on the left knee, because they actually have a right hip problem. So we fix the right hip problem, all of a sudden the left knee starts to respond to normal therapy. This is not always the case. It may not just be knee and hip, it could be knee and ankles, it may be the back, and the back may relate to the hip. But every joint in the human body is going to have another joint that compensates for it. For instance, the neck and the shoulder are one and the same. So if you have shoulder pain, you're going to lift up to hold it in. Well, guess who's doing extra work? Is your neck. So then we start having neck problems and you can't turn. You may have neck pain and then that goes up, or your shoulder drops and all of a sudden you start having shoulder problems. So the problem is these things are connected. You need to have a physical therapist that's going to take a step back and look at everything. Once they look and see where your pain is coming from, this is where they'll say, well, what's bothering you? And you may say stairs. And that's when we'll take more of a functional approach. So we'll take a step back and say, okay, you cannot do stairs. Why? So the patient's first response, or even your response if you're watching this, maybe it's because my quadricep or my leg is weak when I go up the stairs. But when we take a step back, we actually find out it's the opposite hip, or maybe your calves are so tight that you can't actually transition over your ankle to go up the stairs. And so the quad is having to do extra work, and it isn't strong enough to do the extra work, although it's strong enough to take you up the stairs. So we may be working on your calves, then we may be working on some strength for your quadricep, maybe we're doing some strengthening for your hamstrings. Then we begin to combine those types of exercises. So we start stair-stepping you back in to what is functional, of what your end goal will be. Maybe it's stairs, maybe it's leaning over to garden, maybe it's just to sit in your desk chair to finish your normal workday. So chronic pain is not easily treated. If you've gone to physical therapy before, you walked in, they looked at your prescription or the note that the doctor gave them and said, oh, you have stenosis or back pain, and they just start giving you a bunch of exercises, maybe you'll get better, more than likely you will not. This is probably 50% of what our practice has been built on over the last decade and a half. You cannot cookie cutter or just come up with a generic program beforehand to treat chronic pain. So we're going to take the time, and whether it's us or somebody else, just make sure that your physical therapist takes time. We spend an hour with patients on the first visit to look at every joint, really understand what your pain is, what your history is, multiple joints, is there multiple joints, and then construct a program specific for you. If you have chronic pain, we can help. We've done it many, many times before, and it's not unusual for us to be your second, third, fifth physical therapist in a lifetime. So if you have any problems, please give us a call anytime. We are here to help. To learn more about our services, please visit us online at progressiveptandrehab.com.